Tedros Adhanom Ghebreyesus, I beg your pardon, says about 8 countries could run out of HIV treatment due to the United States Agency for International Development fund cutting. And these countries include countries like Haiti, Kenya, Lesotho, South Sudan, Burkina Faso, Mali, Nigeria, and Ukraine. And this is what the Director General of the World Health Organization had to say.
Suspension of most funding to PEPFAR, the President's Emergency Plan for AIDS Relief, caused an immediate stop to services for HIV treatment, testing, and prevention in more than 50 countries. 8 countries now have substantial disruptions to antiretroviral therapy and will run out of medicines in the coming months. Disruptions to HIV programs could undo 20 years of progress, leading to more than 10 million additional cases of HIV and 3 million HIV-related deaths, more than triple the number of deaths last year. The US administration has been extremely generous over many years. And of course, it's within its rights to decide what it supports and to what extent. But the US also has a responsibility to ensure that if it withdraws direct funding for countries, it's done in an orderly and humane way that allows them to find alternative sources of funding. We ask the US to reconsider its support for global health, which not only saves lives around the world, it also makes the US safer by preventing outbreaks from spreading internationally. If the US decides not to restore direct funding to countries, we ask it to engage in dialogue with affected countries so plans can be made to transition from reliance on US funding to more sustainable solutions without disruptions that cost lives. The sudden cuts to US funding are also affecting efforts to eradicate polio, to monitor the emergence of diseases such as avian influenza, and to respond to disease outbreaks and humanitarian crises. Almost 24 million people living in such crises are at risk.
Yes, and that was the Director General of the World Health Organization, Mr. Tedros Ghebreyesus, saying that as much as the US has a responsibility to, or has a choice to decide which programs it funds, it also has a responsibility to take into consideration or give enough time for countries to be able to find replacements which they can use in order to fund those health programs which were funded by the United States. And he's saying that they do have that right to decide who they fund, who they do not fund, but just this immediate cutting or suspension of their assistance to the world, it's somehow detrimental in a way that it affects a lot of people, and it will increase the spread of HIV and AIDS, saying that the spread of this HIV and AIDS, it's not only affecting those countries to which the US has cut the funding from. It also affects US citizens as well, as due to this in and out movement of people from